Hi, I'm Andy Kaytes, and I am really happy to be here with Jean-Michel Molina, and you know him from the Ipergay Study. That's not the end of his talents, but certainly it's been a really impressive study. Having prep on demand and everything. Welcome. It's really nice to see you, Doctor.
Thank you very much.
Sorry that it's raining in Seattle, but that's Seattle.
Well, we have had a very nice weather, the days before, so
yes,
we enjoy Seattle very much.
Which is lucky. So your project is continuing, and what have you noticed?
So we are presenting at this conference a few updates on the Ipergay study. You may know that we are also conducting a parallel study, a larger study to assess the use of on-demand PrEP in real life. But at this conference, we are presenting, as I said, updates on the Ipergay study. One of these updates regards the safety of this regimen, and that's very important to have a safe regimen for PrEP, because we are willing to protect healthy individuals against HIV, but at the same time we don't want to harm them with a drug. And although tenofovir FTC given daily is pretty safe.
And that's Truvada, yes?
That's Truvada. But I'm saying TDF-FTC because in France we are fortunate enough to have generic TDF-FTC, which actually lowers the cost and provides the opportunity to improve access at the same time. But so Truvada here in the US, given daily, as we know, is really safe, but you still have to monitor renal function, because all the time you can have a slow decrease in what we call the glomerular filtration rate. So in other words, the way your kidneys are functioning. And so what we are presenting at this conference is the assessment of these renal function in the Ipergay participants. And what's interesting is that there was no difference between those who received TDF-FTC, so Truvada on demand, and those who were receiving a placebo at the time the study was versus placebo. And so that gives you an idea of the very safe profile of this drug when it's given on demand. As you could have suspected, because on demand needs less drugs, so there is less toxicity, but that's probably not the main reason. There are two explanations for the very good safety profile of the on-demand. Is first because you need fewer pills, 15 pills per month instead of 30 pills. And the second reason is that if you still have some renal toxicity during periods where you are off drugs, this toxicity is reversible. So that means that even though it's a small and very low-level toxicity, with intermittent dosage, you probably have this reversibility phenomenon, which is interesting because in addition to the low drug exposure, it makes the regimen even safer regarding the kidneys. So that's interesting.
I did not know that. I did not know that. That's amazing. So many people around the world are very familiar with your study and follow it, very closely, because it's very impressive. But for those that don't know what on-demand PrEP is, can you just explain that a little? Sure.
So it is actually based on data that were generated by the CDC in macaques, where it was shown that you may not need to give the drug daily to be protected at the time of sexual intercourse. So the idea is to give people the opportunity to take the drugs when they are going to be exposed to HIV potentially. So they take the drugs both before exposure. You need to have enough drugs in your body, in your tissues, in your blood, when the virus tries to infect your body. So you need to take the drugs at least 2 hours before exposure. And to induce a full protection, you need also to take the drugs after exposure. So we call that in the US the 2-1-1 regimen. So you need a loading dose of 2 pills, that you need to take at least 2 hours before exposure, but that could be up to 24 hours.
Okay.
And then you take the third pill 24 hours later, and the fourth pill 48 hours after the first intake. So that means that you are covering the sexual intercourse you have by 2 pills before, 2 pills after.
Wow.
So it's a 3-day regimen for one sexual exposure. So it's appropriate for people who don't have like daily exposures and who don't want to take a drug every day. So it's an alternative to daily. It has been shown in clinical trial to work as well. So and I think it expands the choice for people to take PrEP. So for those who are not willing to take a pill every day, you can take the pill on demand, and actually people switch from one dosing regimen to the other. So again, it gives you flexibility, and it gives you guidance on when to start, when to stop, and how to start, how to stop, which is, I think, convenient regimen. And
you've shown good efficacy.
Well, the efficacy in trial is actually the best data in efficacy comes from this Ipergay study, because in the double-blind phase versus placebo, we showed an 86% relative reduction in HIV incidence, and during the open-label phase, when everyone was receiving on-demand PrEP, the efficacy increased to 97%. So
wow.
So
condoms are less than that.
Right. So you can do better, and people, the few individuals we can infected were people who didn't take PrEP at all. So that's not a failure of the regimen; it's a failure of just taking pills. And so
adherence.
Right. And for those who are not, ready to be adherent to a daily regimen, maybe for them that's more appropriate. Yeah. So again, it is just a way to provide more choices to people, so that they. And I assume that therefore more people might be interested to test PrEP. And what we can see in the US, but in Europe as well, we don't have enough people using PrEP at this time to really be able to contain the HIV epidemic. So providing another alternative to daily PrEP may allow other people, new people, to be interested to test PrEP and to use the PrEP.
And there was a presentation that comes to mind when you say that with the numbers. There was a presentation that, if I remember, showed somewhere in the neighborhood of 500,000 people were using PrEP, and we have 7 billion-ish people on Earth. That's not very good uptake.
No. I think we really need to improve both awareness of PrEP among people at risk, and we need to improve also access to PrEP. And in France, we are fortunate enough to fully subsidize PrEP, so people don't pay for the drug. It's free for them.
Wow.
But despite that, we only have like 15,000 people on PrEP, so it's not high enough. So clearly, access is one aspect. The other aspect is awareness. So we need to improve awareness, and maybe we've been too shy. And when we talk about PrEP initially, we said, well, we should target the high-risk individual. But I think it's the wrong way probably to make people aware of PrEP. I mean, we should talk about PrEP as a way to improve your health, to make you safe regarding HIV, and to be able to have a sexual life without the anxiety of being infected. So it's not for people at risk, it's for people who want to improve their protection. And it's very difficult for an individual to know whether or not he's at risk or she's at risk. And so I think everyone should know about PrEP, that it's a very effective way to be protected against HIV, as good as a condom. And so we need to make more people aware, so that more people will ask for PrEP, and then we can deliver and provide PrEP to them.
Well, and hopefully with your continuing work, that's something that more and more light will be shed, and more people will become aware of it. What are your future plans for Ipergay?
So the future plans really now is to upscale PrEP implementation and to see whether we can have an impact on the epidemic in France. That's our goal right now. At the same time, we are addressing other issues with PrEP. I mean, the issue of STIs is an important issue. How can we better deal with STI, reduce its incidence by a better diagnosis, better treatment, better prevention. So that's what we're going to do, and we have a sub-study now embedded in the PrEP trial in France, where we are going to try to test the vaccine against gonorrhea or antibiotic prophylaxis as well. So again, STIs are emerging as an important issue to address in people using PrEP. And I hope that this research will benefit also people not using PrEP, because STI is not only, of course, in people using PrEP.
Certainly, certainly. So I would love your opinion on STIs. Do you think there are actually more STIs occurring now, or do you think that we're finding more STIs that always existed because we're testing people because of PrEP?
Well, I think you're right. I mean, first, because of PrEP and thanks to PrEP, we are testing people more frequently, we are testing multiple sites, and we are diagnosing a lot of asymptomatic infections that we didn't even think they were existing. So that's one aspect. The other aspect is that, since the 1990s, with the efficacy of combination antiretroviral therapy for HIV, with the data on undetectable is untransmissible, it's clear that people are using fewer condoms and that STIs are increasing. I mean, if you look at the data over the last 10 years, there was an increase in STIs. So what about PrEP? Maybe PrEP could contribute a little bit to this increase. We're not sure about that. We don't have enough data at this point, because with PrEP you're targeting people we have risky behaviors, so these people are diagnosed with a lot of STIs. But what we hope is, because now we put the focus on STI in PrEP users, we may do a better job in testing these people, treating them earlier enough so that they would not be able to transmit to their partners. So let's see what the futures will be, but clearly we need to do more research in STIs today. We have very good regimen for PrEP. Let's now address this issue of STIs, because people who have and can enjoy now a sexual life without the fear of getting HIV, they are not happy when they have an STI, so we probably need also to work on that issue as well.
Yeah, and I guess maybe a wish or a spin-off issue might be that a benefit might be that being able to access treatment for an undiagnosed and maybe asymptomatic STI, maybe eventually that'll lead to not just less STIs, but maybe less drug resistance in some STIs. You never know. One can hope.
You're right. I mean, this issue of drug resistance is an important issue to address as well, and that's why we need also to improve our partner notification. We have new technologies now that we may use. So there is a whole field of research that is opening on STIs, and because people on PrEP are monitored regularly, they come back to see the physician very often, so it's an ideal setting to do research in this area. So I think we will make, I hope, very good progress in the next couple of years on this issue of STI. So we should be hopeful that we're going to improve that.
That's great. So if people wanted to look at your work, do you have posters? Do you have webcasts?
We have posters at the conference. We have the website as well, where people can get information about what we're doing in France, and it's in French, but I hope you can translate that, or you.
Yeah, Rosetta Stone, go for it. Well, thank you so much for joining us. It was very informative, and we wish you continued good work. And
thanks very much.
We'll see you next time.
Okay, thank you.
Take care.